Welcome to Swansea Bay University Health Board's presentation looking at occupational therapy in our children and young person service. In this presentation, we'll be looking at what our service does, why you might access or request support from paediatric occupational therapy, how we work and how we might be able to support. Then we'll be looking at what we're unable to support with, and finally, how you can request support from our service. So what does our service do? The aim of paediatric occupational therapy is to promote children's independence and progress in everyday activities that they need, want, or are expected to do. The three areas that we focus on are self-care, productivity, and leisure. Self-care activities for a child might be brushing hair, washing themselves, or getting dressed. Productivity activities might be going to school, doing homework, or making food. Leisure activities then are those that the child enjoys doing, maybe playing with friends or cycling or swimming. We look at the occupational needs of the child regardless of diagnosis. However, we understand that diagnosis can impact upon engagement and mastering of skills. There are many factors that can impact upon engagement and development of activities of daily living. These might include environment, social circumstances, motivation, developmental delays, motor or sensory challenges, and physical differences or challenges. We consider all of these aspects that may impact upon engagement in an activity and set goals with the child and family accordingly. Why you might request support or access our service. Think about the three areas that we talked about in the previous slide: self-care, productivity, and leisure. If your child has difficulties carrying out everyday activities within these domains, maybe it's getting dressed or brushing their teeth, brushing their hair, making food, or fine motor tasks like using cutlery or doing buttons, zips, laces, or handwriting in school, then it might be worth requesting support from our team. How does our service work? Paediatric occupational therapy works in a child-centered and holistic way. We aim to put the child and their needs, motivations, and wants at the core of what we do. We require engagement and motivation to meet the goals set together. We're occupation focused. As occupational therapists, we purely focus on occupations or activities and the child's participation in these everyday occupations. We look at difficulties with function and the aspects that may impact upon this function. If a child or young person has physical, sensory, or developmental needs, we acknowledge and look at how they impact on their current participation in meaningful occupations. We're collaborative and work with the child, their family, and the people around the family, such as the school, other carers, and other professionals. Our objective is to upskill the people who work with or are with the child every day to help meet their needs on a consistent and daily basis. We're goal-focused and make these goals with the child and young person and their families. We follow a framework where we look at episodes of care. When the goal has been met, the child is closed to the service with the view that further support can be requested at any point if the need arises. Lastly, we aim to manage expectations and set realistic and manageable goals based on the child's developmental stage and physical and sensory profile. It's important to note that if a child is pushed before they are ready, it can lead to frustration and refusal to engage in an activity due to a fear of failure. How might we help? Based on the needs identified, some ways in which we might support you and your child are providing strategies and advice on how your child can be supported at home or school, or another environment where they engage in their meaningful occupations. Might be education, for example, a specialist group, like our parent sensory group. We might look at equipment, for example, specialist seating, hoists, beds, bathing equipment, or toileting equipment. Lastly, we might signpost you to a different service to best meet the need. These services might be Team Around the Family or Early Help Hub, specialist health visitors, CAMS, that's Child and Adolescent Mental Health Services, psychology, physiotherapy, speech and language therapy, or in Neath Talbot, education OT. What are we unable to help with? Please be aware that we do not diagnose. If you are seeking a diagnosis, there are school-based pathways to follow, for example, the DCD and neurodevelopmental pathways. We don't accept referrals purely for the provision of buggies and wheelchairs, unless there's a postural need. If there is a postural need, however, only a buggy or wheelchair is required, referrals to ALAC can be made by any healthcare professional. We do not accept referrals purely for headbanging and are unable to provide helmets. So how can you request help from occupational therapy? Parents, guardians, teachers, elencos, health visitors, and other professionals can call the appropriate number 01792 532 140. OT admin staff will record relevant patient details, including name, date of birth, home address, school, and any relevant diagnoses. They will also record the requester's details, including contact details, relationship to the child or young person, and the main concern. The requester will then be allocated a time slot on an agreed date when an occupational therapist will contact you by telephone to discuss the requester's concerns. Following this, we will determine a further plan, for example, signposting, specialist groups, telephone advice, or assessment face-to-face.